Parkinson's disease is common enough that most of us as physicians have an opportunity to see patients with the condition and help treat them. Hi, I'm Dr. Brian McDonough, and welcome to Primary Care Today on ReachMD. My guest today is Dr. Allison Willis. Dr. Willis is with the University of Pennsylvania School of Medicine. She's an assistant professor of medicine, and her research is focusing on learning more about trends and disparities in Parkinson's disease care. First of all, Dr. Willis, welcome to the program.
Thank you for having me, Dr. McDonough.
Let's start off at the beginning. I mean, obviously you deal with Parkinson's a great deal. Let's just go over the general symptoms for a second for our primary care audience.
Certainly. Parkinson's disease is a multi-symptom disease. It affects the muscles, producing symptoms like tremor, slowness, shuffling gait, stooped posture. It produces psychiatric symptoms like anxiety, depression, apathy, or not wanting to do things that you did before. It also produces cognitive symptoms, which can be as simple as forgetfulness or word-finding difficulties, or as complex as dementia and behavioral changes.
So a lot of those other things I know early on in my career, we didn't focus as much on those symptoms, and yet they are so important and we have to be concerned about them.
You're absolutely right. Those other symptoms, what we call the non-motor symptoms, they are very common and they can actually impact quality of life greater than the motor symptoms, for which we have many treatments now.
Tell me a little bit about Women and Parkinson's Disease Talk. What's that all about?
The Women in Parkinson's Disease Talk project is something that has never been done before. It is a project that is funded by the Patient-Centered Outcomes Research Institute in partnership with the Parkinson's Foundation. And the goal of this project is to develop a research network, a national research network that is focused on women in Parkinson's disease. Now, you might ask yourself, why would we need to focus on women in Parkinson's disease? And there are several reasons why. The first reason is that we have seen in study after study that women are less likely to be diagnosed with Parkinson's disease. And we think as scientists that this may be because there's a protective effect of estrogen in the brain of women that makes them less likely to develop Parkinson's disease. But it could also be something such as the fact that women may have Parkinson's disease symptoms, but be less likely to have them recognized either by themselves, their families, or their physicians. In spite of having a lower risk of Parkinson's disease, however, our research shows that once diagnosed, women have a harder time. They have more disabling symptoms. They have a less robust response to medications, and they have more side effects. So I call this the female paradox of Parkinson's disease. Protected against developing it, but worse off once they get it. And to unravel the female paradox of Parkinson's disease, you need focused research on women in Parkinson's disease. And that's what the Women in PD Talk is going to achieve.
I'm Dr. Brian McDonough. You're seeing Primary Care Today on ReachMD. My guest is Dr. Allison Willis, and you deal with a lot of the trends and disparities associated with Parkinson's. Obviously, you're dealing with women as a group. You mentioned it's not diagnosed as often. Is that because the symptoms can be more vague? I mean, I know we always talk about heart attacks in women. Sometimes they're missed because the symptoms are different. Is it that estrogen dependency, at least in theory?
In theory, and you bring up an excellent example, heart attacks in women. They are underdiagnosed because the symptoms can be different in women compared to men. And we didn't know that until we actually studied in women. That hasn't been done yet in Parkinson's disease. So I can't say if women are diagnosed less often because they have different symptoms, because frankly, we really haven't examined that specifically. That's something that we're going to achieve with the infrastructure from the Women in PD Talk initiative.
It's interesting you bring that up. After all these years, we always get studies. I know when I first got in medicine, women weren't always part of studies, and then they started to include women in studies. And despite the fact that women seem to come to the primary care physician more often, they seek out health care more often than men through most of the course of their lives. They're in the healthcare system because they have children, all those things. It does seem that in many cases they continue, if not necessarily to be ignored, but certainly not studied in such a way as you're doing it now with this particular condition.
You're absolutely right. Women still seem to be understudied when it comes to Parkinson's disease and other neurological diseases. And our initiative is one step, we think, in the right direction. We know that women who are diagnosed with Parkinson's disease are less likely to see a neurologist. And that might account for uh, differences in treatment. It may represent the fact that they have a milder form of the disease, which would again suggest some neuroprotection. But we truthfully don't know because we've never studied.
Now, how far along are you with this? Is this the early stages? Have you been doing it for a while?
This is the early stages. We have done the groundwork disparities research, which we used as preliminary data to justify the need of this award. So we have done the research that I've mentioned, where we found that women are less likely to receive basic care for PD, are less likely to receive advanced or breakthrough care for Parkinson's disease, and are more likely to have a more disabling course, even though they may be protected against it. We've done that research. But now we really need to get down to a more granular level. We need to um, talk with women who have Parkinson's disease, connect with researchers who are interested in women with Parkinson's disease, and together put together a research platform that can answer some of these finer questions.
Dr. Allison Wilson is Assistant Professor of Medicine at the Perelman School of Medicine at the University of Pennsylvania. We're talking about Parkinson's disease. And what are your expectations? I mean, do you have any preset thoughts, or are you just kind of got to let it flow and see what happens?
I am open to how this evolves. We are including stakeholders who have traditionally been excluded or underrepresented in PD research, like women, people who live in rural areas, underrepresented minorities. So I am open to letting this evolve. However, what I would love to see come from this is a research agenda that we can take to funders, that we can take to stakeholders who shape the research agenda for Parkinson's disease. And I want that research agenda to show how important it is to examine the female paradox in Parkinson's disease as it pertains to uh, biological differences, as it may suggest new directions in treatment that can help everyone, as it may suggest medications or avenues of research that may result in neuroprotective mechanisms. And then I would also like the research agenda to be given to payers, to insurers, to show that women, when diagnosed with Parkinson's disease, could benefit from a different model of care than is traditionally offered, could benefit from additional home care, additional supportive care, because they seem to be lacking that. So I am open to how it evolves, but I would love to see an impact in both translational science and in policy relevant research.
I'm Dr. Brian McDonough. This is Primary Care Today on ReachMD. My guest is Dr. Allison Willis. And you mentioned that there hasn't been much done. Are there any landmark articles with women in Parkinson's that have ever been put out there? And if there are, do you use them as a guide?
There are some landmark articles. I will say that most neuroepidemiology studies have consistently shown that women have a lower likelihood of being diagnosed with Parkinson's disease. So there are several outstanding articles which suggest that, and they have assessed Parkinson's disease in different ways, using different methods in different countries, in different populations, but have consistently found a lower incidence of Parkinson's disease among women. I can't say that one particular article is better than the others. With regards to disparities, I think that some of the really excellent data has come from my research group, has come from Lisa Schulman's research group at the University of Maryland. She, of course, is a collaborator and a co-investigator on this Women in PD Talk initiative. And so those would be probably the two places where much of the work on women and disparities in Parkinson's disease have come.
Dr. Willis, we've talked about a lot. Is there something I didn't ask you that you thought we should talk about that's an important point you wanted to mention before we wrap it up?
There is one thing that I think is important that I think is under-recognized. Women have a lower risk of Parkinson's disease if we believe all the data that has been presented thus far. And yet, because women age successfully, and because there are more older women than older men, and because the greatest risk factor for Parkinson's disease is age, there are actually almost equal numbers of individuals in the United States with Parkinson's disease, men compared to women. So there are large numbers of women with Parkinson's disease in the country. I think that's not well recognized. And understanding why women are protected from Parkinson's disease but seem to do worse can lead to treatments that are better for everyone.
Well, Dr. Willis, I'm afraid we ran out of time, but I want to thank you for taking the time to join us on Primary Care today. I really appreciate it.
Thank you, Dr. McDonough.
And if you've missed any of this program, you can always download the podcast. Thanks again for listening.